Good morning. Good morning. Thank you. We're going to be talking about artificial intelligence, but we need to reinforce our human connection. And so I always like to start with a good morning to everyone. It is a true honor and a privilege to be here in Seoul at the World Biot Summit. My name is Ricardo Baptista Leite. I am the CEO of HealthAI, the global agency for responsible AI in health. And we are very grateful here at HealthAI for the kind invitation we received from the government of Korea to be able to organize this session on the topic of responsible AI. And being one of the side events, to see a full room here is a great sign of the importance, but also the attention that this topic is attracting from around the world. I will be hosting and moderating this session today. And so I would like to express to all of our speakers, those that sent us videos, but also to those that are here in the room with us today, for their availability for joining us. I will be presenting them further down the run of the show. But I will be starting with a brief presentation about who we are and what we're doing in the field of responsible AI. And I want to let you to know a couple things just before we start. First of all, that some of our speakers may speak in Korean, but all of you have translation from Korean to English and English to Korean. Feel free to prepare your headsets for the rest of the session. And of course, you have the channels right here. And of course, we'd kindly ask you, since this is also streaming online, if you could please turn off your phones or at least put them on silent mode. That would be very much appreciated. And always feel free to reach out to us. I'm here, and also HealthAI's Chief Regulatory Officer, Paul Campbell, who will be speaking, is also in the room. We're happy to meet with you today or tomorrow while we are here. So I'll be jumping directly to my presentation. And so I kindly ask the technical staff to put up my presentation. And I will be talking to you precisely about responsible AI in the field of health. And it's interesting that at HealthAI, we conducted a survey when we were redesigning our strategy over a year ago, where we asked governments, patient organizations, university partners, and private sector partners what their thoughts were about the topic of artificial intelligence in health. And one of the most common words that came back to us in this survey was the word fear. People are concerned about the potential harm that artificial intelligence may have in their health, the negative impact it may have among citizens. But I think it's important to also enhance the potential opportunities that these technologies bring upon health systems, allowing us to rethink health systems, to be able to redesign how we are going to deliver health and care in the future. Today, most health systems are still too focused on reacting to disease. Artificial intelligence presents to us an opportunity to rethink the way we deliver health and care so that we can be more focused on quality of life, on well-being, on reducing the burden of disease, so that we can make sure that we free up resources to treat those that inevitably will get sick. And we already see how AI is being applied across the board. We see how from research and development to manufacturing and distribution, and we're at the World Bio Summit, this is a very key area for AI applications. But also when we talk about prevention, population health, the power of predictive analytics being able to have impact, we're already seeing that in different parts of the world. Post-care and monitoring, even in administrative management and other forms of management, hospital waiting lists, hospital bed predictive analytics, all of these things are happening. Many of these technologies are aimed at reducing costs. Other of these technologies are actually focusing on producing health outcomes, or a mix of both. One of the problems we are seeing, though, is that many technology companies, instead of using this opportunity to rethink how and imagine how we can use technologies to redesign health systems for the future, they're trying to retrofit the technologies into the current analog world of healthcare, the way it has been designed until now. So we need everyone, from healthcare workers, managers, private sector, academia, patient organizations, governments, to use this opportunity to think forward. How can we use these technologies to leap towards a future? And this is particularly important even in low and middle income countries, in low resource settings. So this slide shows you the distribution of startups across the world in the field of AI. And of course, the US has a very important presence. And we can see, of course, California. We know that here in Asia, and of course, South Korea, of course, appears with a very relevant dot in the map. Europe is more or less in the middle. But what we also see on this map is low and middle income countries, Latin America and sub-Saharan Africa and in parts of Asia, they are absent from this map. And so artificial intelligence, which actually can be the greatest equalizer of our time, may also be, if we are not careful in the way we design the ecosystem, may actually be the greatest divider of our time. It all depends on us, on how we design, develop, and deploy artificial intelligence into the world. If we do this correctly, we can actually accelerate the approximation between low and middle income countries and those that have most resources. But if not, what we already know as the digital divide may actually grow, leaving too many people behind. And so we need to get this right. We also see as a proxy, as a window into the future, how patents are showing the exponential growth of investment in this space. When we look at R&D, we see that exponential growth. This is from the last Global Patents Report. 61% of all patents registered are from China, 21% are from the United States, only 2% from the EU plus UK. Of course, if you do a quality-adjusted analysis to this, it'll be a bit different. But still, this is a pattern that everyone in the field has to be very knowledgeable about the reality we are facing today. But in reality also, I started talking about the potential applications of artificial intelligence, but I also said there's fear. And that fear, I would say, many times is driven by the hype of media. Sometimes it's not based on fact. But the truth is the fear is there. And there are risks that we cannot ignore. The problem is in most countries around the world, not every country, but in most countries around the world, there's still some level of Wild West environment where companies are coming in, they're selling their technology to hospitals, to clinics, and there's truly no really oversight or regulatory mechanism to make sure the technology is safe, effective, and quality assured. Moreover, in many countries, we still have zero to none post-market surveillance mechanisms to be able to detect if something goes wrong with the application of the technology with real-world evidence. And so it's important to address these challenges. Many countries around the world and regions are doing so, and they're applying, and we saw how in the US, the previous administration launched an executive order, the European Union launched the EU Act. There are many initiatives around the world trying to address these challenges. Even here in Korea, there's an AI Act being discussed in the National Assembly. And so this is leading to some level of fragmentation that is concerning, because one of our goals at HealthAI, as the global agency, as a nonprofit, is to help the world use this technology and accelerate and scale the use of AI-driven technologies that can lead to better health outcomes. A fragmented world will lead to slowing down the pace of adoption of innovation. So there are 4 key challenges that I would highlight. That fragmentation issue. We need to have some level of global alignment, and that's what we were working on. But also the fact that AI is a fast-evolving technology. I'm a medical doctor, but I worked in politics for many years. I was a 4-term member of parliament from Portugal. And I can tell you that the political process is too slow to keep up to pace with the speed of AI and technology development. We need to give more power to regulators and make sure that the regulators have the capacity to keep up to pace with the technology, which means they have to have the resources to do so, so that we can accelerate that process. Data concerns, of course, are extremely important. The regulatory frameworks need to address data governance, data security, and data privacy. And once again, post-market surveillance. I stress on this point because I think it's one of the most relevant and important points when it comes to artificial intelligence in health. Being able to detect early on if there's something going wrong with the application of AI in a clinical setting is one of the most important tools we have to be able to build trust towards these technologies. I'll give you an example. As a medical doctor, when I prescribe an antibiotic to a patient with an infection, I'm not thinking very much about the safety because I know the safety was checked by the regulatory agency. What I'm concerned about is, am I prescribing an antibiotic that is the most effective to treat the infection of the patient I have in front of me? Today, when thinking about using an AI technology, healthcare professionals, doctors, nurses, pharmacists, managers, governments, before using the technology, they're second guessing. Is this safe? Can I trust what the computer is telling me? We need to get rid of those questions. And the only way to do that is by having a regulatory process that builds that trust so that we can use the technology and we know that in the background we have teams that are looking precisely at those components of safety, of quality, and effectiveness. And so we identified this challenge very clearly, that the lack of governance was increasing risks, of course, but it's also leading to lack of trust. And when people don't trust the technology, they don't adopt the technology. And we want to accelerate the adoption of technologies to accelerate its potential beneficial impact on health. So we need to address the global governance issue head on. And so that's where we came in as the Global Agency for Responsible AI in Health. At HealthAI, we are a nonprofit based in Geneva, working with many partners and governments around the world. I acknowledge the presence of the government of Norway here, NORAD, one of our supporters. And we are very honored to be working with those governments and also with the World Health Organization, because this is a unique opportunity for us to truly come together. And how do we work? And I think this slide explains it better than anything I can tell you. We are a bridge in the middle. We're an implementing partner for governments. So on one side of that bridge, you have the normative standard-setting organizations. There are many organizations out there defining standards. In the field of health, you can think about WHO, international standards organizations. You can think about UNESCO, OECD. Everyone is either publishing guidelines or standards. We at HealthAI do not do that. We do not publish standards or guidelines. On the other side of the bridge, you have the national and regional regulatory bodies. These are the bodies that have been mandated by governments to validate technologies. And we see their role in being able to validate AI solutions for health systems. And so we are in between. We do not validate solutions ourselves. What we do is, as an implementing partner, as a technical partner to governments, we help translate international guidelines and standards and adapt them to the local context, helping countries build up their regulatory capacity, co-creating their regulatory capacity to be able to validate AI solutions for their own health systems. So basically, our strategy is built up on 4 key pillars. One is to basically build up and co-create those regulatory mechanisms, so governments will be able to have a team within the regulatory ecosystem that is capable of validating technology based on the quality, based on the safety and effectiveness of that technology. Also putting in place health technology assessments so we can finally define a value to reimburse these technologies. And for private companies, creating a clear pathway to access to market, which today is not clear, making rules and regulations clear. As soon as we have, and we're going to be selecting 10 pioneer countries by mid next year, those countries, along with the others that follow, will be part of the global regulatory network that we will be managing. This global network of regulators will not only allow knowledge sharing, but it will allow us to also put in place a global early warning system. Once again, post-market surveillance is one of the most important elements to build trust. So if there's an AI tool that here in Seoul or in Rwanda or in Switzerland or in Brazil that shows any risk or has caused any harm, within this regulatory global early warning system, we will be able to raise a red flag in real time to all of the regulators, making sure that the private sector and the regulators can work together to solve the technological challenges before they become a problem at scale, so that citizens know that we are putting citizen safety first and that we are doing everything in our capacity to mitigate risk. And we will also be building a global public repository of AI solutions. So basically, as regulators approve the technologies for their own countries, they will be feeding into this single platform that everyone can visit. It's an open source platform where you'll be able to see what AI technologies are out there and which regulators have approved them around the world. This is useful for regulators to see which others have approved so they can accelerate their approval process. But it's also a global marketplace. So if you think about a technology that is approved in Korea, the first place, after being approved here, it'll be put on this global marketplace so everyone can see. And the same applies to a startup in a low and middle income country in Africa or Latin America. We'll be able to see innovation at a global level much faster and to see what innovations are out there and how transformative they can be. So we're helping to scale the impact of that technology. And of course, we will be able to provide advisory services to both public and private sector about how to make sure that you are applying the principles of responsible AI. But we can't do this alone. And that's why we've launched a community of practice. This Health AI community of practice is one that brings together governments and regulators, but also academia, civil society movements like patient organizations. It's also bringing together private sector companies and developers. Everyone who is involved directly or indirectly in the field of artificial intelligence and health is invited to join. You actually have a QR code. It's free of charge. And you can actually apply and be part of our community where we're going to foster conversations around the topic of artificial intelligence and health from a perspective of global governance and regulations. This is extremely important. And I invite you all to join as institutions because we have this vision and we will be working on this topic at a global level, but we need to make sure that our mission, which is to make sure that safe, quality, effective tools are being deployed and scaled as fast as possible to achieve the positive impacts in health, is actually happening on the ground. The only way to do that is having a feedback mechanism from those working on the ground. And we have to be humble in this new age of this intelligence revolution to be able to do this with all of you, with all of the institutions around the world that are interested and highly committed to the vision of the responsible use of AI to improve health of citizens, because we are absolutely certain that we can only do this together, and together we shall work for better health for all. Thank you very much. And now it's my pleasure being able to close this opening moment of our side event. I will be presenting now a video message from our esteemed colleague from UNESCO, Dr. Gabriel Ramos, who is Assistant Director General for Social and Human Sciences of UNESCO.
Dear ladies and gentlemen, thank you for this opportunity to speak at the third World Bio Summit on the challenges of opportunities for the global governance of AI for health. Healthcare is one of the areas that is really being transformed by artificial intelligence and magnifying the potential to deliver for good. AI is enhancing diagnostic, enabling real-time data, and holding great potential to tackle critical health issues. You remember during the COVID-19 pandemic, AI was really core to understanding the way the virus behaved, how we could advance the vaccine development, and it really revealed how data science and digital technology can improve health outcomes. We have some other examples. In Brazil, the government developed a platform that predicts dengue outbreaks, illustrating AI roles in managing public health crises. And in the realm of neurotechnology, the convergence with AI has revolutionized the way we understand the brain and opened the door to more powerful and precise applications. This is very promising, but AI developments don't come without ethical concerns and risks, especially for vulnerable populations. We know that AI poses challenges around data privacy, health equity, misinformation, and fundamental rights. Global governance have not yet adapted to address this risk comprehensively, particularly in the Global South, which often lacks the necessary regulatory frameworks for safe and equitable AI use. And the disparity in AI health capabilities between the Global North and South continues to widen. While advanced AI diagnostic tools aid early disease detection in many countries in the North, regions and members in the Global South struggle to deploy even basic AI technologies due to limited resources. This is a great challenge, not having access and only benefiting the few. AI initiatives for tuberculosis detection in sub-Saharan Africa face hurdles, for example, including limited internet connectivity and high equipment cost, unlike the rapid AI and neurotechnology advancements in the US and Europe. The technological advancements in health sector also raise serious concerns about privacy, autonomy, and equality that really need to be well framed, and it was included in our UNESCO 2021 recommendation on the ethics of artificial intelligence. We are addressing these concerns also in our current work to implement the recommendation and in the development of a normative work on the ethics of neurotechnology. And aligned with the conference theme, which is the Triad Future Investments for a Healthy and Secure Decade, I suggest that we could have a path forward that centers participatory engagement and diverse stakeholders in AI health governance. Engaging a variety of voices, including patients, healthcare professionals, marginalized communities, in policy discussions will foster more inclusive AI outcomes. Training healthcare professionals with ethical AI, data privacy, and patient rights will empower responsible AI adoption in healthcare and would make it more fine-tuned to really address what patients want to be used AI for. And finally, addressing the global data imbalances is crucial. Data is fundamental for AI development, yet many regions lack accessible, representative, high-quality datasets, even in the context of open source. Making data more equitable will support a truly global research ecosystem. At UNESCO, we are advancing this commitment through the implementation of the recommendation on the ethics of artificial intelligence, which is the only global standard in this field covering 194 countries. To support all of our member states, we have a network of AI experts without borders that provides real-time policy support, exemplifying our dedication to inclusive and ethical AI governance. Advancing these frameworks demand also fulfilling very core requirements and commitments to fairness, to equity, to justice, and to be even aware that these issues are important to bring to the fore and not only the technological conversation. Through a collective dialogue, we can develop governance that upholds human rights and health equity, ensuring that the AI serves our shared commitment to humanity.
Thank you. We have an online audience, and your applause has reached Paris for sure, where Gabriela Ramos is based at UNESCO. And I think she brought in very important topics. So that, as you all know, the session is called Challenges and Opportunities for the Global Governance of AI for Health. And the work that UNESCO is doing is particularly relevant, as she mentioned, in the fields of policy, data governance, and basically on the ethical AI governance. And so this is something that we're very grateful to Dr. Gabriela Ramos. We're now going to move towards our in-person presentations. And following that, just for all of you to know, we'll have a panel discussion, and there will be an opportunity for questions from the audience. So you can start thinking about those questions. We're going to continue now with our next presentation from Professor John Lim, who is Executive Director at Duke National University of Singapore, their Center of Regulatory Excellence, CORE, being Singapore one of HealthAI's partnering countries. And we are very, very grateful, Professor, that you have come all the way to join us here. We look forward to your presentation on the topic of participatory engagement of diverse stakeholders in development and establishment of effective governance for AI systems in health.
Thank you very much, Ricardo, for this invitation. It's a great honor to join you at this side event of the World Bio 2024. And thank you very much also to the Government of Korea and the Ministry of Health and Welfare and WHO. I've been asked to speak about participatory engagement. Just to give some background on myself, I was formerly the Chief Executive Officer of Singapore's Health Sciences Authority, but for the last 10 years, I've been running the Center of Regulatory Excellence at the Duke National University of Singapore Medical School, and I continue to be a senior advisor in the Ministry of Health. The center was set up in 2014 to really look at the issues related to health products regulation across the region. And we're supported by the Ministry of Health, the Health Sciences Authority, and the Economic Development Board. And we're looking beyond just capacity building, but also to promote policy innovation, of which AI currently is a key area. And we're looking at establishing regulatory networks. So we look forward to working with HealthAI as we move forward. The scope of the center is to build up this network collaborating platform, and we're building up to the 2 bars on the top of the screen, which are to strengthen regulatory systems where we started, which was a focus on health products, but now we're also looking at health services and health systems, as I will explain in a few moments. We have an education component, a think tank component, and also an advisory area as well. What we have been looking at, especially as we have gone into our 10th anniversary this year, is that we notice that there is a convergence as we look at health regulation. So while we ourselves, as a center, began focusing on health products regulation, which is also where I came from in the HSA in Singapore, we see this convergence with health services regulation. Of course, there's also health professionals regulation. And what is interesting in Singapore is that where previously the Health Sciences Authority looked mainly at health products, which is where medical devices and AI-related products sit, the Ministry of Health was focusing on health services regulation, and that's also important when we think of the application of AI. And they are going to come together in the coming year, in 2025, so that products and services regulation will be increasingly converged. As we looked at our 10th anniversary year, the areas that you see on the left of the screen, was it the right of the screen? The right of the screen are the key areas that we thought are important to look at. And obviously, AI and digital health is a key issue for us to focus on. So when we look at governance in AI health systems, there are many issues to think about. In terms of AI in health, there is a lot of potential. We can look at improved outcomes, personalized medicine, enhanced patient care. But as has been mentioned several times already this morning, the importance of governance is there. We need frameworks to establish and ensure accountability, responsibility, and ethical decision-making. We need to address concerns over safety and efficacy in AI applications. And so this whole aspect of ethical considerations, and the previous speaker highlighted this as well in terms of his company, we do need to ensure fairness, transparency, and non-maleficence. This must underpin AI development, and especially the use of AI in health systems to address potential biases. And of course, we need to ensure that technologies uphold the dignity of patients. So what my center did earlier this year in April and August was to work with the Singapore Ministry of Health to hold 2 roundtables. The specific question was to ask, within the Singapore context, does healthcare AI require a distinct AI governance framework? So as you can see on the upper right-hand side, the objectives of the 2 roundtables were to look, of course, at the scope of healthcare AI, but what are the key challenges in deployment and development, and then how, as we bring the stakeholders together, which is what this talk is about, how do we then develop potential regulatory approaches to enhance AI governance and stakeholder accountability? So we brought experts, not just from Singapore, but there were international experts as well in the 2 roundtables. And I will share towards the end of this presentation what the conclusions were. So when we think of participatory engagement, when we think of AI in healthcare governance, obviously, if we're talking of participatory engagement, we must have very inclusive and collaborative processes that bring together diverse stakeholders so that, in a sense, all the key people who are engaged in this can contribute to decision-making. And this will ensure that governance strategies are representative and, of course, importantly, grounded in shared values. We're doing this at a national level, but as has already been indicated this morning, we need to look at this regionally and globally. The significance of engagement is to then ensure that the voices of all the relevant parties are heard and considered. And this is really vital for creating AI systems that are equitable and responsive to community needs and ethical standards. And there are many benefits also to engaging diverse stakeholders because we then bring in varied viewpoints and experiences. This also ensures more innovative solutions. We come out of siloed thinking. and it helps to reduce the risk of biases and blind spots in AI governance, which can be rather significant if we only look at it from a particular stakeholder's perspective. If you look on the left side, when we assembled the roundtable participants, we were looking at primary and secondary stakeholder categories. So there are those in the orange boxes who are directly impacting or impacted by healthcare operations, policies, and outcomes. Obviously, patients and families must figure significantly, but there are healthcare providers, healthcare organizations, also payers and insurers have to come into the picture, regulatory bodies for sure, and obviously the developers in terms of pharmaceutical, medical device companies, and other, I would say, industry partners as well. The secondary categories are those who are supportive of or facilitate, but they may not be directly responsible for healthcare delivery. It does not mean they're any less important in stakeholder discussions. And these would include academic research organizations, technology IT companies, but also remember professional associations and unions. The policymakers and legislators are very critical. Also remember NGOs, non-governmental organizations and advocacy groups, the suppliers and support services, and importantly, media and communication stakeholders. So when we held our roundtable, we tried to bring in as many of these as you can see on the right-hand side. We may not have included everyone that I listed on the left, but there was a fair representation across the stakeholders in those two roundtables. And so I think that's a useful sort of approach to take in any stakeholder engagement as we look at strengthening AI governance guidelines and frameworks. Now, what drives diverse stakeholder perspectives? We need to remember these four things as well as we engage stakeholders. There are different motivations of the stakeholders. There is a need to promote inclusivity and inclusion. Transparency is extremely important. And again, as has been mentioned several times today, trust is so important because if the trust is not there, it's not just the patients who use AI in healthcare, but amongst the stakeholders themselves. If there's no trust amongst the community, then it's also difficult to really get significant stakeholder engagement. So when we think of motivations, we need to understand diverse motivations, ethical, economic, social. These would drive the stakeholders to participate, and also ensure that the frameworks align with the various interests and needs. When we think of promoting inclusion, we need to ensure active inclusion. It has to be a very proactive, intentional process, especially of underrepresented populations. And the governance frameworks then need to address equity and access to ensure that systems are just and they benefit all. For transparency, this is also important because transparency in decision-making processes will help to demystify AI technologies. I'm afraid it's not possible to totally demystify because of black box concerns and the way algorithms work. But as we bring the stakeholders together, transparency, to whatever degree is possible, will help to lower fears and to raise confidence among stakeholders about the use of AI in healthcare. And of course, building trust is essential for encouraging stakeholder participation and ensuring that there are accountability structures, because this helps to provide assurance that all voices are respected and considered in the governance process. There are various frameworks to encourage effective participation. So the earlier stakeholders are involved, the better. Feedback loops need to be set in place. There need to be collaborative dialogues. There has to be a co-creative element so that design and approaches, there's co-designing and co-creation of approaches, and there has to be public deliberation. And then, of course, from a more academic perspective, case studies are also very helpful. So in terms of the two roundtables that we held, we used mainly collaborative dialogues and we analyzed case studies. And when we brought the participants into the room, it was not a lot of presentations. We actually broke them up into work groups. So some of the participants, and they were very senior experts, said it was like a boot camp. But they were not complaining. They said it was a very good thing to come together and work through the issues and look at case studies. When we think of the more specific issues related to tools and methods for engagement, these are some of them. The collaborative tools and digital platforms, surveys for feedback, community meetings, workshops, and focus groups. And so the center itself, not just specifically what we did this year, but we have always been promoting the use of workshops and focus groups because these bring the stakeholders together to facilitate in-depth discussions. Roundtables are very important to create trust and enable open dialogues and provide this direct channel for voicing concerns and opinions. And of course, even if we cannot come together physically in the room, like even this event today, technology-enhanced platforms, virtual live streaming platforms are very important to allow meetings and experts to talk, to connect, to share perspectives, and to participate in real-time discussions. What are some of the key challenges to engaging stakeholders as we want to engage them in looking at the governance of AI in healthcare? I've mentioned trust issues, but there are also resource allocation issues because there's never enough time, there's never enough funding, never enough personnel. And there are obviously barriers to engagement because of socioeconomic disparities within and across regions, but there are language barriers. It's also been mentioned there are cultural barriers, and there's also lack of awareness. So some potential solutions, they look simplistic, but to do them can involve quite a significant amount of effort and intentionality. There should be constructive engagement to build up trust, to demonstrate commitment, and respect is also very important. There needs to be an assessment if resources are not enough, then how can they be strategically allocated? And obviously, when we're thinking of barriers, they must be identified first and itemized so that then suitable strategies can be found to address them. It is also important, having gathered all this information from the stakeholders, to properly evaluate them and to assess them. So there are obvious methods which I think everyone in the room would be familiar with: quantitative, qualitative analyses to ensure that there are robust feedback mechanisms. And some of the metrics of success are indicated here. What is the degree of satisfaction at the end of the day in terms of the engagement and the outcomes and outputs? How diverse have the participants really been in terms of the engagements? And what has been the quality of the feedback? So this is important. So as I come to the end of my presentation, as we went through those two roundtables earlier this year to look at healthcare AI governance, firstly, that diagram that you see in the yellow box, these are regulatory tools that regulators can use. Not everything is just regulations and legislation on the extreme right-hand side, but even areas like stakeholder education, industry self-regulation, guidelines and standards, regulatory sandboxes, and accreditation all form part of the regulatory toolkit of regulators. So the two roundtables concluded that in Singapore, at least, we did not at this point require new legislation, and the current regulatory tools are good, but they need to be reinforced and enhanced with additional guidelines, and their scope needs to be tested. So for stakeholder education, beyond what currently exists, the recommendation was that there should be more consumer education, specifically for lay persons and even for healthcare professionals. And it was interesting that in some of the discussions, not in this particular roundtable, but in another session that we had on AI earlier in the year, it was identified, we always think that younger healthcare professionals might be more open to AI, but in fact, a study in Singapore has shown that it is in fact the older, more experienced doctors, nurses, who are more sort of open to using AI because they can fall back on their experience, whereas it is the younger healthcare professionals who sometimes are more hesitant to use AI because they don't have that degree of experience. So that was a very interesting understanding. For guidelines and standards, we already have existing guidelines for AI in healthcare. Now, in Singapore, there are a lot of multi-ministry engagements, but in a specific term, while most of the medical devices in Singapore are managed by the Health Sciences Authority, the Ministry of Health has a set of guidelines called the AI in Healthcare Guidelines, and the short form AGILE, it's pronounced, actually indicates that regulation needs to be agile and the guidelines need to be agile. So the conclusion from the roundtables was the guidelines are still good, but they need to be enhanced. But we do need to look at areas like data labeling and accountability, trustworthiness of algorithms, contextual risk, and also how to strengthen the professional guidelines and advisories for professionals. There needs to be more use of regulatory sandboxes to test the scope of existing regulations for emerging healthcare AI needs. specifically the usage of real-world data and also multiple data platforms and the use of generative AI. But for the health products approach, it was felt the existing regulations by the Health Sciences Authority are sufficient at the moment. So from this, it gives us a sense how we go forward in terms of taking the stakeholders within the Singapore healthcare ecosystem and bringing them together as we continue to look at strengthening healthcare AI governance. Finally, as we think to the future, we still need to have, in fact, a very agile approach. So innovative governance approaches are important. We need to have decentralized governance systems. We need to have flexible governance models. And of course, Google DeepMind is a very interesting approach. When this article was published in the Straits Times in Singapore, what struck me was that the sensing of the need to look at regulation was rather limited there. But it is important nonetheless, as we go into areas like this, to strengthen the stakeholder collaboration, to have early engagement, sustained collaboration, so that the innovators work with the policymakers, and this is vital for ensuring agile, robust, and fit-for-purpose health AI governance frameworks. I would like to thank my colleague, Professor Kavita Palinapan, who helped me prepare this presentation, and to thank all of you for your attention this morning. Thank you very much.
Well, thank you so much, Professor Lim, and I think that it's easy to understand why Singapore is also among the forefront of countries dealing with the regulations of AI in health. Your methodologies that you approached in terms of participatory engagement with different stakeholders, I believe, is actually a very good example for other countries and regions to look at, and how you address the need for engagement not only within the country level, but also at the regional and global level, I believe is part of the reason why this collaboration between HealthAI and Singapore is presented as so relevant. And I think you also presented, this is a very new field for many, and how even some of the most advanced countries like Singapore have such a humble approach, I would say, acknowledging, despite having such robust regulatory frameworks already in place, always the need to improve, to enhance, and to continue to move forward, and also the issue of sandboxing of technology, which is actually one of the topics that at HealthAI we are including within our technical assistance and support to governments, because we also too acknowledge this as a very much needed approach from a technical perspective, not only regulatory sandboxes, but also innovation sandboxes to foster the responsible use of technologies and AI in health. So moving on, we're now, this is next presentation is someone from HealthAI, but I'm very happy to be able to present Dr. Paul Campbell, because it's his first week on the job. And so we're very happy that he was able, on his first week at HealthAI, to join us here in South Korea. Dr. Paul Campbell was, until very recently, the head of software and artificial intelligence at the United Kingdom MHRA, the United Kingdom regulator, with 20+ years of experience within the Scottish NHS, a physician himself, but highly specialized in the field of AI and software as a medical device. And now, Dr. Paul Campbell is HealthAI's Chief Regulatory Officer. And today he will be speaking to you about existing regulatory frameworks to oversee AI systems in health and foreseen gaps. Paul, we're very happy to have you here. The stage is yours. Thank you.
Good morning. Thank you very much for the opportunity to be here for myself and for HealthAI. I'm delighted to talk to you today about existing regulatory frameworks for AI systems. As Ricardo said, this is my first week with HealthAI. So this is more a reflection from probably my experiences working in the healthcare system and as a regulator. So I'm going to start off by explaining that I'm not going to explain something that's super complex. The reality is the regulatory mechanisms of the world are a highly complex system. You know, they're beyond complicated. In 15 minutes, I couldn't tell you what all the regulatory frameworks are. So that aspect's a bit pointless. So that means there's no point in me speaking to you. No, of course not. I'm going to tell you try and break this down to some basic things that I think just are good start points to help understand the regulatory frameworks that are important for AI in healthcare. So one thing, there are 2 million different types of medical devices in the world, roughly speaking. No one even knows the exact number. There are 7,000 different categories. Some people say there are 10,000. No one knows the exact number. Trying to regulate something that complicated, you'll understand. And to be honest, that's all before AI. So these numbers don't include the explosion of AI and AI agents that we now see. So these are very out-of-date figures already, and I produced the slide last week. So next one, yep. So in terms of what are the regulatory landscapes, what are the regulatory frameworks that exist, these are some of a number of different documents. The first one on the left there, the Global Atlas of Medical Devices, is the WHO document. It gives you a list of all of the different types of regulatory agencies and mechanisms that exist around the world. It doesn't necessarily explain what's there for AI or for software. And there's some others. There's some papers, that one there, about the developing landscape and sort of for medical devices in Africa, indicating how it's not really sufficient. And then we ourselves within HealthAI have recently put our first iteration of sort of mapping of the governance in HealthAI, mapping of the governance and health of AI medical devices. So we too have joined this journey. So there's loads of things out there if you want to try and see. I can't tell you all in 15 minutes. It's too complicated. What I'm going to try and do is try and make it a bit simple, try and give some principles, and I hope this is okay for everyone to try and help you understand the regulatory position, the mindset, how regulators regulate medical devices in general, because that's relevant for AI. So just going with basic principles. The first thing to really make clear and obvious, to my knowledge, I think all medical device regulators in the world that have any regulation in place more or less regulate AI under the term of software. So again, to my knowledge, and I haven't scoured every single one, every definition uses this word software, and nowhere does it specifically say sort of AI within the definitions. Within the legislation itself, there are lots of guidance documents, but within the legislation, it's all based on this concept of what's the definition. And that's the WHO definition. It holds very true to many of the definitions used in regulations all over. So it's a device, a thing, software that has a medical purpose. So that's the first most important principle to sort of think through. I want them for time. And again, this definition I know is very closely aligned to the definition in the UK legislation, which is effectively about 20 or 30 years old now. So these definitions are what's in the world's legislation, and they were all written before AI. And as Ricardo, I think, mentioned, and I too obviously work for UK regulators, part of the UK government mechanisms or the civil service, changing legislation takes a long time. So that's legislation, that's where we are right now, it's with software. So I'm going to talk about what's the approach for AI. Bear in mind, from a legislative point of view, that's just software. And again, these are just general principles of approach. In general, all medical device regulators approach all medical devices, and that's everything, the hardware devices, the software, the AI, with these sort of three principles. Firstly, does it even qualify? If it's not a medical device, then the regulators almost sort of stop at that point, and they have no legislative need or ability to engage beyond that. There's a very key important point. I think this is quite important. I think from colleague Dr. Yu spoke about sort of the population health aspects of it as well. Medical device qualification is for devices that are for individual patients. So generally speaking in the legislation, if you're using AI at a population level to understand population healthcare and you're not directing it to an individual's care directly then it generally doesn't qualify as a medical device. So the medical device regulations become irrelevant to you at that point. So I would argue that AI is just the same as SAMD is software as a medical device. So AI is the same as software here. The next thing that all regulators do is they then, if you qualify, so you are now a medical device, we will then start to talk about it with you or work through it. Generally, everyone then looks at a risk-based approach, and they want to try and classify the risk. All the different countries have different names, ABC, 1, 2A, 2B, but in general, in the main, all regulators classify in either a 1 to 3 risk category or a 1 to 4 risk category. Generally speaking, class 1, or the lowest level of risk. In many countries, these are what we call sort of self-certified or self-registered. So these are products that may well be registered as medical devices, but that's only done more or less by the manufacturers of the device themselves. They're registered, but no one's really looked at the evidence of them. So in general, I'm making very broad statements, but that roughly applies. And as it goes up beyond that, levels 2 or 2 and 3 or 2, 3 and 4, then usually at that level there's much more scrutiny applied because these devices carry more risk. And again, I would say that whether that's software or AI, that's the same for AI. And then one of the next things that they routinely do for any device you have is clinical evidence. It's a really simple question. As Ricardo mentioned, I'm a clinician, or I was a clinician myself for many years. As any other doctors, clinicians in the room, or even just any other person would understand, the simple question, does it work? Really simply, does it work? Can you prove to me that it works? And we add on to that in health, can you prove to me that it's safe? So generally everyone else has some mechanism of doing that, and it's usually driven around clinical trials, clinical investigation, and that's a sort of caveat that stays with us. And our colleague, Professor Lim, I think, mentioned the importance of that sort of evidence as well. The approach taken in clinical evidence is not the binary, is this a medical device or is it not? It's not the binary, is this perfectly safe or is it not perfectly safe? Because that's not reality. It's a benefit-risk analysis that always goes on. What's the current system? What's the current level of healthcare? Does this product improve the benefits over the risks? And then the last bit there, PMS, post-market surveillance, that's a mandatory feature in general for all medical devices around the world. So that's Paul's sort of, and again, AI or software, it's the same. So that's Paul's one-slide summary of the global picture of medical device regulations. Hopefully that helps a little. Regulations are always backed up in this sort of hierarchical order, regulations and then standards, and then after that guidance. And I know I've just come from the UK MHRA, they have a legislative programme going on there at the moment, and the phrase used, it's legislatively light and more relying on guidance, because there's a need for that agility to improve the guidance. Even standards in the middle, standards take a long time to do as well. And we're awash with all sorts of standards. That's just some that I found from various agencies there. So that's your general approach if you want to be involved with AI medical devices, is to know the regulations, to do those according to standards, and then look at the general guidance. And that's evolving rapidly around the world. And in general, the more you go to the left, the slower that becomes, and the more you go to the right is where we probably all are as a global community on this. So that's all of software, but what are so far I've made the case that AI is just software, it's just handled by the regulations of software, but I think we know that there are some differences with AI technologies as opposed to standard software. So I've put them in these 3 buckets: bias, transparency, and adaptivity. Different people use different names for them, but bias is probably one of the commonest ones, the human nature of it, the fairness of it. But from more of a technical standpoint, bias is really important because it will impact on the performance. There's some good evidence of studies where, there was a chronic kidney disease monitoring AI system. It was really, really good in the population. You move it to another hospital, different population, different ethical group, and the performance just drops off. So from a safety and performance point of view, that's really important. But as I said, it also worsens the health inequities. I've listed there one project that we worked on, again, when I was with MHRA, so I'm a transition point here, was standing together data diversity. It's got like a really, really good collaborative program of work, with, again, coming out with recommendations of what you have to do with your data when you're developing your products. Transparency, now that's also transparency, explainability, interpretability. These are all different terms. But I think one thing that's really important from a more technical basis is, can you explain the decision? You know, if your AI product tells you to give the patient the medication, and then the patient asks the doctor, why are you giving me this? I don't think the answer can be, I'm not sure, the computer said that I should. Like that doesn't work, that doesn't engender trust. So, and as Professor Lim pointed out, it's transparency as far as we can. We can't always get to the bottom of the transparency of AI models, and that's maybe not necessary, but we have to understand enough to be able to explain it. So transparency and explainability, otherwise you lose trust. Adaptivity, unlike standard software, there's a big problem about performance drift, performance and concept drift that can occur when you use AI technologies. So the nature of the changing response to the algorithm, how the system around about it changes, and these are complex system changes that go on. That's one of the other reasons that post-market surveillance, whilst it's mandatory for all devices anyway, it becomes even more critical for AI. And there's a move in the world where people are struggling to generate the sort of pre-market evidence for AI, to maybe bolster that by having good post-market surveillance, and maybe that's even akin to what is known as real-world evidence. You know, that, you know, can you get something on the market and run it under strict observation to generate that real-world evidence? So that's, I believe, whether there's sort of technical AI differences. Beyond the technical AI differences, there are more sort of ethical AI challenges. I call these things, you know, I've got accountability. It's really difficult. It's okay potentially to have a human in the loop and have an AI-guided clinical decision support, and then the clinician or the doctor or the nurse puts their head to work with the AI and says, I think this should be the course of action. You know, that's okay, but what if we have a fully autonomous system and it makes a mistake, it gives you the wrong judgment as a patient? We haven't really sorted out the accountability or the liability for that. I'm going to just rush through a few of these for time, folks. Privacy, you know, intellectual property, where do people get their data? These are huge challenges. There have been many breaches. None of that engenders trust. You know, at a societal level, we have a real issue that, done poorly, we will worsen inequity of healthcare. John also mentioned that we should have maybe coordinated on slides a bit before, John, the knowledge and the skills. There's a real awareness and there's a real skills gap across all players, you know, from patients, from citizens, to purchasers, to developers, to regulators as well, even at times in certain aspects. And there's an economic cost in all of us investing, you know, lots of time, money, and effort in some of the wrong things at the wrong time. You know, we can end up with the wrong solution to a specific problem. That's particularly important to us here at HealthAI. If we're looking at low and middle income countries, they may have very different sort of, you know, health requirements compared to where I live in the UK, for example. So that's the ethical one. What and how are we regulating this? This comes a bit to John's slide, who we'll hopefully see in a moment. So we do regulate medical devices. At times, we're now in the territory of thinking, this thing is not a medical device. It has a health purpose, but it's not a medical device. It doesn't qualify. And then how are we regulating things from that sort of societal and ethical, from the societal and ethical aspects for the whole of the population? We generally do regulation. You hear this language, I hear this language a lot, and if you hear it, hopefully this will explain it to you. People talk of horizontal and vertical legislation. So in the world of medical devices, we have the vertical of medical device regulations. Everyone follows that strong vertical. There are other verticals that exist for commercial products, for finance products, for privacy aspects. Each one of these verticals already has existing legislation in place. And the world AI sort of disrupts that fairly significantly and is leading to people to contemplate putting in what we regard as horizontal legislation. It's interesting that you'll have heard of, you know, Ricardo mentioned the executive order in the US or the EU AI Act. That's a sort of horizontal legislation. Some people are doing that. Some people are not doing that. They're doing, I think, what John mentioned, which is say the current legislation sort of works. We maybe just need to tweak the guidance. So there's some really, you valid conversations going on in the world right now about whether we need to increase more legislation at a horizontal level or just stick with the verticals and do enhanced guidance. So I'm not giving you an answer to that. That's where the regulatory discussion is right now. And it's a complex world. Anytime you put in the horizontal legislation, there's a real live discussion in the EU right now about the implications of the EU Act for the medical device regulations. How do they work together? It's a really important thing. It takes a long time to work it out. So it requires strong collaborative approaches. Many parties have to be involved in this, as again, John's list of stakeholders. So collectively, whilst there's legislation and regulation, I'm here to talk to you about regulation. I think there is an important trend towards, yes, we must have that regulation. Yes, we have to improve that regulation, be that through guidance. But yes, we also have to start thinking about responsible approaches. We have to. There's a wide picture of trying to align globally on this. This is very much a global game. The sort of the standards and the guidance. That it doesn't ultimately help us all if everyone develops something completely different. So we have to align that. Skills and capacity, and of course the early warning system. That's akin to the sort of post-market surveillance world. The ability to let people see the successes of products that we use, and then. At HealthAI, we're also, as Ricardo mentioned, developing this knowledge portal, the community of practice, which is very much in that space of the building skills and capacity. So that's a sort of link back to what we're doing at HealthAI, but hopefully was a useful explanation of Paul's view of the complete global picture of regulations of medical devices. Thank you.
Well, thank you so much, Paul, for that presentation and overview. I think it sets the scene very well for the panel discussion we're going to have. As I said, there's going to be room during the panel discussion now where we're going to have questions from the audience. So if you have questions that you're burning to come out, your moment is coming. But I just want to say that out of all of our presenters, sadly, Christian Wickert had an unfortunate episode where his airplane actually had engine problems while they were flying over the Pacific, and they had to fly back to the US when he was coming to Korea. But he was kind enough, as soon as he landed, to record a video to send to us so we could get his participation. So Chris is the head of global digital policy at Merck, the German pharmaceutical, and we're going to share his message now.
Hello everyone, I wish I was there with you. I wanted to start by thanking Dr. Ricardo, all the HealthAI team, all the other panelists and authorities present at the event. Let me start just by sharing some of the initiatives that we have around responsible AI. It all started many years ago with the digital ethics team, something that we've built based on everything we've learned on bioethics. And this digital ethics team facilitated many discussions to create our code of digital ethics. And this process is even published in a peer-reviewed paper. It has 5 core principles, and they really guide everything that we do. So if anybody in the company has an idea, a digital idea or AI idea that they want to pursue, it will come to the digital ethics team, and the digital ethics team will present them to our digital ethics advisory panel. We created this panel with experts from the industry, from academia, globally, with some civil society representatives. And this digital ethics advisory panel will discuss all those solutions and really give an external point of view and a recommendation on what we are doing. So it's really ethics by design. Another good example is the PARA assessment, the principal at risk assessment. So if someone brings a project to that digital ethics team, they will assess for each principle and see if there's anything at risk, and that will be brought to the digital ethics advisory panel that will really discuss and see if the project should continue, if it should stop, or if there are specific risk measures that should be taken to mitigate some of those risks before continuing. Another example is for the data analytics and intelligence team. They have they have a digital tool where they answer a few questions, and that will give them a green light or a yellow red light to pursue that analysis, or stop and say, hey, you should discuss this with the digital ethics team before doing that analysis. So it's a control point even before running an analysis on data that you have. And we believe that this kind of ethical process is really what guarantees that the outcome will be aligned with what we really want. We also created many other AI solutions. So we created a venture, a 50-50 joint venture between us and Palantir called Syntropy, really to make science faster, to create a platform, an ecosystem where all the stakeholders can bring their data. They have full control of their data during the whole time, and have the most secure platform to guarantee that they know who's assessing that data, with what kind of opacity they want in that data, to really break the silos and guarantee that data is being shared in a responsible and absolutely secure way to deliver the outcomes that we want, the new treatments, the new drugs, the new efficiencies that we are all searching. And we can only do that with this trustful collaboration. And this platform and Syntropy was built exactly to facilitate that. But we also have some internal products developed, for example, in the bioprocessing part of it. So we have Cynthia and Edison. Those are solutions that we developed that other pharmaceutical companies can use, other researchers can use. And when you think about that, it's really our health market is so big. There are so many elements in this value chain, so many different applications for AI. From right at the beginning, when you're trying to find a new molecule, during the trials process, after the market, for the healthcare systems, for the patients, the physicians. There are so many elements. It's so difficult to regulate all of that. And it's difficult also for governments and for others to see what kind of trusted solutions are out there. That we really believe in transparency. We really believe in having this ethics by design, so that you guarantee the outcomes based on a process that, during the whole process you're being ethical. And that's also why we believe that HealthAI is so important in terms of gaining speed for all the stakeholders. How can I learn if some solution is ethical, is responsible, and I can trust? If there are institutions that facilitate that really allows government to quickly come and see, oh, these tools are responsible, these tools we can use. It will generate a lot of efficiency globally for the whole system, so that you don't have each and every one doing the same analysis and the same assessments and kind of getting lost among all this plethora of solutions available right there. And lastly, we also believe that governments play a crucial role in preparing the foundations for all these innovations to really flourish and gain scale. We have been discussing with governments around the globe on the importance of pilots, of initiatives that will use some broadly available tools, but apply industry-specific models, apply initiatives to develop talent and expertise that will work in all that. So I really hope that this panel helps you bridge some of those gaps, to bring everybody together, to keep discussing what are the main issues and how we can deliver those solutions to more companies, more researchers, more governments, and really deliver the outcomes we are all searching for. So again, thank you so much.
So thank you so much, Chris Whitaker. Rickert, we we're very grateful for him being able to record this video after such difficult circumstances with his travels. And he brought, I think, very important topics also to the discussion that we've been briefly touching upon in the previous conversations around the issue of data, of efficiency, about the idea of coming as a pharmaceutical company, the usage of AI for the discovery of new molecules. These are all incredibly new areas that demonstrate the need to build basic regulatory capacity that in many countries and regions around the world is either non-existent or needing for enhancement and improvement to be able to respond to some of the issues that Chris mentioned around how do we address and ensure that technology and AI is used responsibly, and how do we actually scale technologies. And so we're now going to be able to move towards our session. All of our speakers will be joining me on stage. Once again, thank you to all of you for your speeches, but we have one more addition who I'm very grateful to welcome, Dr. Dongmin Kim, who is CEO of JLK Inc. For those of you outside of Korea, in Korea everybody knows you, outside of Korea, just to make sure that JLK Inc. is Korea's #1 listed company in the medical AI industry, specialized in AI-driven medical imaging and diagnostic solutions. Also a very important angle to be discussed in this context. We need to bring together the public sector, the private sector, the civil society for this conversation. I invite all of our speakers back on stage. And an applause for our speakers, please. Okay, so we've made it here. Now we're going to continue the conversation. I'm going to start with the first question. Let's call it a generic question for all of you. I'm going to kindly ask you to keep your answers as short as possible so we can then find time to open up for the audience. And I'm going to go back to what Dr. Paul Campbell mentioned, because I think he distilled a very complex issue into a couple very basic but critical questions. You know, he was talking about benefit risk analysis. There's an idea that we sometimes hear in the media that we want a utopian approach to AI, where we want it to be perfect before we use it. That is not possible. In medical school, the first thing we learn is first do no harm, which does not mean only do something if you know it will not cause harm. What first do no harm means is mitigate risk. We've done that with the pharmaceutical products industry and also with medical devices, where we know there are risks, but the benefits clearly outweigh the risks when they are approved into the market. So this benefit risk analysis is critical. But then Paul said, ultimately, for those working in the field, the two questions that people ask are, does this work? And is it safe? And these are two critical questions that we need the ecosystem to be able to answer. And so my general question to all of you, and maybe we can start from this side until that, and once again, we might be speaking English or Korean, so always have your translating set with you. So what are the facilitators and barriers that you see when it comes to promoting responsible AI innovations in health?
In my case, the passion of medical staff is most #1 factor of facilitation of adaptation of innovative AI in healthcare, because in Korea, the medical situation is tough, but many medical staff are very motivated to study and adapting advanced AI system in their system, alongside with some risks. But they have high confidence that we can make it effective one in someday. And most barrier is, I think, two factors. #1 is data silo. I think that is common in worldwide issue. We have many organizations, and many organizations have concern about privacy and security, and also they have some kind of culture to preserve their data in their local systems. And number two is the concern about the risk of harmful AI in this field. So, as you said, performance and accuracy is not that clear in, especially in large language model and foundation models. So many people are concerning about that, and even the regulation organizations have a difficult time to make concrete regulation on it. Thank you.
Thank you very much. You've highlighted two key challenges, the regulatory environment, but also the data silos. And we've heard that, you know, if AI was a rocket, data would be its fuel. And so it only moves with good quality data, and that's a challenge that needs to be overcome. And data governance is a critical aspect of our work at HealthAI within the regulatory ecosystem. Which leads me to Professor Lim, your thoughts on the barriers that we see.
I think the key issue is a barrier of ignorance and lack of understanding. So the importance of education and stakeholders talking together is critical, because risks will always be there when you're either talking of a product or a service in healthcare, but we need to understand what is the nature of the risk. And I think one of the biggest barriers now is that the different stakeholders see risks slightly differently, even though they're fundamental core risks. So it's very important that we really talk about what exactly is the risk concern. But I think this whole issue of data security and confidentiality is critical, because if people don't really believe that either institutions or governments can protect this, then it's going to work against the further development of AI. And the other aspect that I mentioned earlier is that, in fact, healthcare professionals and regulators do need training and capacity building, because they themselves, actually I should say we, because I'm also a healthcare professional, we tend to be quite conservative. We look at the opportunities, but we are concerned, and especially in AI, when we're thinking of algorithms and large learning models and deep learning, we don't quite know what's happening, as there's a lot of self-learning going on. So I think that's even more critical to talk about what the real risks are. And even if we're very honest and say we can't manage them, then that helps the transparency, getting the people together and collectively working towards determining what is the degree of benefit risk. And we have to realize it's constantly evolving. So it's not something we can just decide today and say that's the situation. It will have to be an ongoing conversation, an ongoing level of education as well.
Thank you so much. And that last point is so relevant about the ongoing needs. Today you may be the most advanced regulatory agency in the world. As we've seen in the presentations, 6 months from now, you can be completely outdated. And so this is a shift in a way, the way regulators have to prepare themselves, and addressing the knowledge gap, addressing the need for capacity building. So at HealthAI, one of the things we do when we engage with countries is we start with what we call discovery training, precisely to build up that knowledge in parts of the world where it is further behind, so to say. And this takes me to you, Paul, with your experience from the UK regulator, understanding this ecosystem. I think you've addressed this partially, but maybe it would be great to detail a bit more the facilitators and barriers to seeing responsible AI become mainstream.
Thanks, Ricardo. I suppose that the first barrier I've realised today is not to speak after Professor John Lim, because he gives the answers that I was just about to give. What are the barriers? I think awareness, education, skills, and capacity for regulators are definitely is a big barrier. How can you handle millions of products, millions of applications when you've got most regulators aren't that well staffed around the planet? So I think that those are two major issues. So well done, John. You beat me to it. So I had to come up with a third one. So my other one, which I think is a barrier that it's not really, it's a bit of an elephant in the room type barrier, which is, it was on my slides, accountability and liability. I think that's a really serious issue. it crosses so many boundaries. It crosses the professional boundary, you know, the colleges, the professional regulators. It crosses the medical device regulatory issues, and it really gets into sort of privacy and societal aspects as well. And to my understanding, most of the landscape of medical device problems or medical healthcare problems when it comes to liability and accountability, it's very individualized, and it often goes after, you know, one body or one entity, and yet I don't think that's the reality of the world that we're in with AI. I think, again, John's slide, you had all the stakeholders, you know, like the IT companies, the developers, the AI models, the stakeholder participants that fed into that, the data governance of it all. I believe we're moving to a world of sort of having to work out better mixed liability, you know, better ethical and responsible ways to handle that.
Well, thank you. And that's something we've been hearing both in the public and the private sector also. And the issue of who's responsible at the end is going to be critical. And AI will force us more than ever, I believe, to create bridges between those that develop the technologies, be it in the private sector or elsewhere, and those actually playing a role in the regulatory frameworks and developing also the legislation and so forth. If we want to get this right, we do have to work together. And that takes me then to Dr. Kim, coming from the private sector, a true leader in this field. How do you see the application of responsible AI, but most importantly, from your perspective, do you see facilitators and barriers, not only in your country, but also at a global scale?
Yeah, actually, well, I think, well, the AI technology is improved very, very fast. And, well, as you know, well, the explainable AI system can give us very trustful result for understanding how they decision or how they analysis in the data. But well, I think well, the AI technology changes very fast, but the regulation changes very, very slow. That makes really big barriers for us. As you know, all speakers says about the data diversity. And we feel, well, the data diversity is really, really important for the training. But I feel the surveillance system is more important in the real world. Because, well, we actually, conducting some clinical trials with a very, good data set that we're considering all diversity of the we can sort, but well, in real world, there comes a really very various situations. So I think well, to accelerate the application of AI for the medical field, I think well, this reliable surveillance system is really, really important, and all well the country or the government side has to prepare the kind of surveillance system for the AI algorithm, I think.
Thank you so much. I think the speed of legislation versus the speed of technology, that's a classic conundrum. But with AI, it's tenfold. I mean, it's something that we clearly need to address. And so building up capacity at the regulatory level and giving potentially more power to the regulators so that we don't depend on constant changes in legislation, having more blanket legislation that gives that power to regulators may actually be a need. And you also mentioned, and I'm happy for this, and I'm thankful for mentioning surveillance, because it is extremely important that we detect any challenges and problems early on before they become problems at scale. And this is a critical aspect of collaboration between public sector and the developers and the private sector. So at this moment, I would like to ask if there are any questions from the audience. This is the moment that you'll be able to ask all of our experts in the room if you have any burning questions of your own around the topic of artificial intelligence. The questions can be asked in both Korean and in English. We have a simultaneous translation. So if there's any question, this is a moment to raise your hand. But if not, we will continue. And you guys want to make me work, and I'll continue to work. And so I actually have many more questions of my own. The other question now, maybe now we'll start with you again, Dr. Kim. Looking at current legislations, what lessons do you think we can draw from the current legislations for medical devices when looking into the future application of regulations in predictive AI or generative AI in the field of health? Because you come from a company that develops a lot of medical devices, so you've been dealing with that. What lessons do you think we can take from that regulatory environment now looking into the future with all of these new Gen AI tools that are coming out?
I think, the generative AI can apply for the interfacing from the clinician and the patient and AI systems. I think this communication is really important. I think, we have to prepare some regulatory for the ethic check. By now, we just check about the safety or this kind of performance, but we never prepared about the ethic check for the AI. So, especially in medical field, I think the government or we have to prepare some method for the ethical problems in there, I think.
Yeah, the ethical conundrum is a big one, and that leads me to Paul then. I know a lot of discussions have been happening. I would say the regulatory environment is not there yet, but you coming from software as a medical device and coming from the AI regulation space in health, how do you see this Gen AI approach to regulation?
Yeah, so, I think, by now, our company just developed the diagnosis supporting system. In this kind of AI, I think the possibility is very low to make some ethical problems because we just analysis the MRIs or CTs, this kind of images. But when we start to communicate with doctors, it comes some ethical problems, like maybe this problems comes from the data bias, I think, because all some prevalence of the disease is different from the racial problems. But the AI has to analysis of very common senses. So, this is the problem for us.
Thank you so much. And Paul?
Do you want me to
Yeah, please.
A view in Gen AI? Generative AI is incredibly powerful. I think one of the issues is that there are some fundamentals of how the technology works that cause problems for medical devices. Generally speaking, I know we discussed medicines. Medicines have safety problems. They have adverse events and risks, but there seems to be something societally, human understanding, like no one seems really comfortable that your medical record could be made up and hallucinated. And depending on different techniques that are being employed, I'll hopefully speak to Dr. Yu later, find out what they're doing in NAVR, but even most of the technology still has this real risk, maybe 10, 15%. Some studies have said up to much more than that, chance of having hallucinations. So for me, it's all about picking the use case. At the moment, there's a lot of work going on in summarizing of medical records. But if you've got a 10 or a 20% error rate, now it's not to say humans are perfect, and that's valid, but if you imagine a world that's going to rapidly accumulate the documentation of healthcare with a 10 to 20% error that only just continually adds. So I think we have to keep looking at that technology, see where that can be improved. But I think more importantly, we have to look at probably better use cases, more appropriate use cases. And again, it would come back to the sort of the benefit risk. And, you know, if you're in a scenario where there's nothing and this is an improvement, then we should probably focus on the use cases, I think, because the regulatory side, the healthcare is always going to ask that, you know, can you show me that it's robust and that it's safe?
Yes, this is a big ethical question that we hear around the world, especially in low and resource settings where if we think about a village or a town in a low resource country where there is zero care, and being able to provide some level of care, understanding that it may not be perfect, that's an ethical discussion that needs to be framed in a regulatory ecosystem. And that answer is not there yet. And so this is the work that collectively we need to work on. And also making sure that these technologies have a checks and balance system in a way where the human in the loop right now is still critical. And this is another discussion that we've been having. And a lot of these technologies, despite the confabulations or hallucinations, we see that they do many times produce in specific niche areas very impressive outcomes. But also many studies are showing that the combination of humans plus AI can even improve even more. So that symbiotic, thinking of the healthcare workers of the future being more of cyborgs, if we will, of that integration and symbiosis between machine and humans, will force even medical universities, healthcare workers, even in pre-grad, to rethink the way we're training healthcare workers of the future. What is the role of the human in that health system, and what is the role of AI and Gen AI, and how do we create that regulatory ecosystem? So that's a perfect segue for you, Professor Lim, in the sense that coming from your university, say, I know Singapore is already having conversations around how do we deal with Gen AI. Your thoughts on this issue, please.
So I think if we think of the whole regulatory ecosystem, and Paul actually mentioned this as well in a slightly different way from the way I presented it, we cannot look at silos and just say, you know, medical devices and software as a medical device is regulated by the health product regulator, and the issues that flow into institutions and healthcare practice are regulated by the Ministry of Health. So I think when you're thinking of this in terms of the broader aspects of regulating AI, whether generative AI or other elements of it, we have to change the whole regulatory framework actually in our countries. So this convergence, I think, is quite critical because the way we're currently set up mitigates against the conversations across the system. It's not just a life cycle anymore, it's across the whole system in the terms of which AI is deployed. So I think that's a fundamental thing, which, as I mentioned in Singapore, we're really going to try and do this within our healthcare system. So I think that's the first step, which other countries also have to think about. And the whole aspect of the human in the system is very essential at this point in terms of not just addressing the risks of generative AI, but building up trust and addressing the concerns, because actually they're different sides of the same coin in a way, that if you can't address that, you can't manage the risks either. Because the healthcare professionals have to be very much part of that. And if they feel that they can't trust the system, they can't be part of managing the outputs of what AI tells them, then I think at this point, at least in our history, we can't move further. I mean, when you talk of moving towards cyborgs in the future, well, I think if you say that too soon now, you'll make everyone a bit afraid and get pushback. But I understand what you're saying, but I think probably at this point, if we talk about humans interacting with AI to manage the risks, including generative AI outputs, then I think that's probably what we should be doing at this point. And just a final point, that little highlight I mentioned in my talk, I was very intrigued by this study by one of our medical schools in Singapore, which highlighted that the older, experienced healthcare professionals were more comfortable dealing with healthcare AI than younger doctors, younger nurses, younger pharmacists, simply because they did not have that level of experience to interrogate the outputs of AI and question, is this a hallucination or is it valid? So I think that's also important to note.
Well, thank you so much. And you touched upon so many issues, but I'd highlight the inclusion of healthcare workers in developing the frameworks. Because if the healthcare workers do not trust the regulatory models that are put in place, then you have a barrier in terms of adoption. And you need that feedback also to make sure that you're creating something that is useful for the real world. And you did mention in your presentation this concept of older or more experienced healthcare workers being more comfortable and using AI, seeing it as a complementary component to their work that can help them in their work, knowing that they have the level of knowledge to identify potential risks more than the younger generation, which I find as a sign of hope that the younger generation doesn't think they know it all, which is not always the case. But when you said that in the presentation, I saw my colleague Paul Campbell moving around in his chair. So I'm going to put you on the spot, Paul, because would you like to comment on that particular aspect? And so we'll get to you in a second. But on this issue about the older part, the more experienced workforce being more at ease, so to say, with AI.
Absolutely. Yeah, so thank you. Thanks, Ricardo. My laughter comes from being a clinician. You know, I was a clinician for 2 decades, and I think about things clinically as well as regulatory now. And I understand that conundrum, and I understand why. And I think there's been other similar studies. There's been some in sort of radiology imaging would have done, like, you know, very junior radiologists, sort of reasonably experienced radiologists, and very experienced radiologists, and they all perform differently when they use AI as well. So there is something about that level of experience. It equates to sort of automation bias issues with using technology. You know, we're innately driven to more or less believe what's on the screen, and then that you believe what's on the screen even more depending on the context of what you're in. If you're in a busy society, you know, busy emergency room, an overburdened healthcare, or a waiting list of patients outside, it becomes easier to believe things. So I'm really pleased to see that, you know, junior, you know, clinical colleagues are saying, well, hold on a minute, we may not know, and we're not so sure about that. So I think it makes a lot of sense. It's understandable, and it fits into an even longer term problem of like feeding this into sort of undergraduate curricula, because, you know, trying to get something into the clinical undergraduate curricula is a long journey, but we need to teach and train people about things such as automation bias and why they should quite rightly question that. So I'm glad your colleagues are questioning it.
Oh, thank you, Paul. And this takes us then to Dr. Yu from Naver Cloud, which has a business model that has truly had impact in the world, and particularly in Korea, but beyond your borders, with the use of Gen AI also. Looking at the future, and as Gen AI becomes more and more prevalent in health systems, how do you see the regulatory needs evolving? We've heard people discuss potential need for clinical trials. The head of your competitors at Google in the regulatory affairs was saying the other day that we should test Gen AI the same way we test medical doctors. That's another approach. All of them are not, I would say they're controversial. They're not consensual. What is your take on this?
I strongly agree with the competitor in the Google because generative AI is more like human-like, has human-like output, so it's very difficult to evaluate each outcome from generative AI with respect to the classical machine learning system. So maybe it is nearly impossible to evaluate every output of generative AI in the field. So maybe we can have some post-surveillance system with human feedback, but humans are sometimes too busy to dig into the result, and it's not enough to qualify the result in the field. So as the example in Dr. chart, maybe my chart in EPIC, humans are easily to be lazy to evaluate the result of AI and just deliver the outcome to the patient without any qualification. So I think we need to see the AI more as medical step rather than just a deterministic machine. And the other fact that I think important in regulation is in generative AI era, many companies are depend on a core technologies from other companies. That means many companies will make their generative AI-based medical device based on Google's or Naver's or other big tech's foundation models. So they have limited to access the core technology, so they cannot expect the detailed and accurate results of using foundation models. Maybe minor update of big tech's foundation model can affect very critical change in the field. So we should consider that too. And the last thing is, I think interaction with generative AI. Okay, let me rephrase my thing. Collaboration with human and AI is also be considered in the effectiveness of medical device in Gen AI medical device, because before the Gen AI is more like an exploration tool of knowledge rather than giving a deterministic answer. So exposed to the result of generative AI can help medical doctor a lot. But if we do not consider that effect, the capability and potential of generative AI-based medical device shrinks a lot. So maybe we should make another measure or consider the contribution of collaboration effect of generative AI. Thank you.
Well, thank you so much. And that's a lot of food for thought. What you said, I would say, is not absolutely unanimous in the world, which is good because it means we have a serious conversation to lead. But I agree with you that we have to have a different approach to Gen AI if we want to maximize it. And I think a part of what you said is consensual, is the need for post-market surveillance. That is clear. How we're going to assess the technologies is something we clearly need to work together between the developers and those regulating. But you raised a very important issue that we don't talk enough about. Those working in the VC world and in the investment world in technology know that most of the things that are being presented as Gen AI are actually built up on top of one of the foundational models like Naver's. And so in reality, who are we assessing, right? And then there's the issue, who is responsible? The liability issue that Paul alluded to if something goes wrong, right?
Yes.
And so, yeah, well, we're at time, but if you want to comment quickly on that.
No, go.
No. But so just to say, I mean, these are open questions that I think are very important, and that the fact that we have companies that are building foundational models like yourselves that have put security threats and responsible use of AI as a top priority, I think is extremely important for humanity. And so our gratitude to you and our gratitude to all of our speakers here. We've reached our time. The last question I had, we won't have time to answer, was what should governments invest in with regards to knowledge and resources to facilitate and implement responsible AI in health ecosystems? Since we don't have time, I'll give a quick answer, which is governments should work with HealthAI, which is the global agency for responsible AI in health. We were very proud to be part of the World Bio Summit, very grateful to the government of Korea for their kind invitation, and extremely grateful to our amazing speakers who fostered, I would say, the best session at the World Bio Summit until now. It was the first one, but it was certainly the best. So thank you to all of you, and a round of applause for them, please.
Thank you.